and tech. We're so excited for our first bi-monthly financial Q&A and are so grateful to Diahanna, our financial advocacy program manager, for seeing a need in the community and creating the solution. We hope that you'll find this series of benefits, and we had so many great responses with several people pre-submitting questions in the last few weeks. So if you don't get your question in today, we hope to cover them in future webinars and articles. You can also sign up for the Q&A and submit your questions as early as possible. The sign up for the Q&A that will be happening in February should be available in the next few weeks. With that, I will go ahead and introduce Diahanna. Diahanna is the financial program manager specializing in financial help for multiple myeloma and AML patients. As a professional financial advisor and former caregiver of her husband who was diagnosed with multiple myeloma, Diahanna perfectly understands the financial issues facing cancer patients. With that, I will turn it over to you, Diahanna.
Good afternoon, good morning, depending on where you are. I am in Louisville, Kentucky, so it is, we're well into the afternoon. So there's been a lot going on, and right now we are in that open enrollment period. You only have until December 7th to look at that, so a few more days left. And I wanted to open this up for questions especially about this urgent Medicare Part D. There's a lot of questions we got regarding that. But I also have some questions on here that were pretty specific to medical questions, and I cannot answer medical. I am not a clinical person. That would have been in a previous life that I wanted, but I ended up where I was supposed to be. So I will defer those over to your healthcare provider, but there are some questions I can't answer. So let's get started on that. So one of the first questions was talking about treatment, and they want to know what organizations outside of pharm can they get help for doctors, labs, copays, and they are not on Medicare, and they have a high insurance premium, probably a high deductible plan, and deductible with copays after deductible. Any advice is much appreciated. So there are nonprofits, and we have a financial resource page that has access to all types of financial resources. This answer will apply to some of the other questions that are going to come up today. But there's nonprofits as well as pharmaceutical links for you to find out what copays, what pharmacies offer. And a lot of those things you may be aware are based on income. Pharmaceutical companies are usually very generous, 300 to 400, sometimes 500% of federal poverty levels. Your nonprofits may not be as steep, maybe 200 to 300 of your federal poverty levels to get assistance through them. And they do open and close throughout the year. So they're not open all year round. So it's usually it's always first come, first serve. So the earlier you can get on those things, the better off you are. They come on and go off sometimes throughout the year. Right now, I know there are a couple that are open for copays, deductibles, and sometimes your premiums. You have HealthWell Foundation as well as copays.org. I believe they have assistance available, but they are for people who are on Medicare. So keep an eye on those things. They do open up. We're in the beginning of the year, so there may be some more money coming out, funds that'll be available. So the second question. During the enrollment period, if the medication is uncovered for 2025, but covered for 2024, is the cap max out of pocket still $2,000? So I think there's a lot of confusion regarding this cap of $2,000 that is effective for 2025 year. Whatever's happened in 2024, whatever's coverage and plans those things are still in effect until the end of December. There are some changes. A lot of plans will be changing their prescriptions that are on formulary. Some will be coming off. Some of the tiers will drop. And you know the prices are different under the tiers where you're responsible for until you meet that max out of pocket. So, and there are also some drugs that are dropping off Part Ds completely. In this case, and we're going to address this several times throughout the day, some options you have available to you. So the 2025 max out of pocket for Part D covered drugs, those are drugs on formulary that your plan will cover. That is where that applies to. If there are drugs that you have been on or you will be on that are not in formulary or are not covered by your plan, you are responsible for the full out-of-pocket cost. So there may be drugs that you're on that no longer covered under your plan, and you may be paying more than $2,000 out of pocket. That is why it's very important for you to go in and look at your plan, make changes if you can find a plan that does cover more of your, that will cover more of your prescriptions, or look for generics, see if those are covered under your plan, and ask your doctor now, because they're going to start getting really overwhelmed with all these requests for exceptions through your insurance company. They will have to write a letter saying it's medically necessary in order for you to stay on some of these drugs that are showing under your Part D drug that's not covered, so that you can have an exception for it to be covered during your treatment period. So that's something you're going to have to do. And I would suggest you do that as soon as possible. You know, prior authorizations, they can knock it down the first time. You want to make sure that you have time to do that so you will not drop off treatment. The next question. We're talking about again. Medicare Part D is no longer covering Revlimid in 2025. I would say most, if not all, Medicare Part D will not be covering Revlimid. Check with your plan. My out-of-pocket costs will be $270,000 for the year, which I can't, for 2025, which I don't know how many people can afford that. When I asked my oncology nurse practitioner about getting the generic, she indicated that they are unable to get it. That's interesting, because they can always write a script, go to your pharmacy, and you may have to get it through a specialty pharmacy, but you should be able to get the generic. Again, you need to check your plan to see if even that generic is going to be covered. So again, this goes back to asking a doctor for an exception through your insurance company. Do this ahead of time, like now, especially going into next year. It gives you some weeks to get this situation straightened out. Ask for an exception, ask for prior authorizations, get those things done so that you can go off January 1st running and not have any issue. That's going to be a common theme throughout the day. And I don't want anybody to get stuck, because if you have not looked at your plan, if you've not looked at that, your particular plan that you have for 2024 sent you out in September, a change in benefits plan or what's going on with their plan, they sent that out. You need to read it, open that piece of paper up and look at it. If you don't have it, call them, get on the line, do it. You have until the 7th. We have 4 more days in order to get this done. Do not get stuck. And this doesn't just apply to myeloma drugs. It look at all of your prescriptions. If you have diabetes, if you have any other issues, if you have CLL or AML, look at your plan. You want to make sure that you are going to be covered, that you have the best plan possible. If you have a Part D plan, or you have a Medicare Advantage plan, that $2,000 out-of-pocket cost works the same, because Advantage, which is Part C, has that medication prescription included in it, but you still need to look at that. I know a lot of people who have those Advantage plans, and they said they've been wonderful. They've been wonderful. I'm not going to have a problem. I trust them. Okay. I don't know anybody can trust a insurance company, because you have no control of what they do. You need to go in and look at everything every single year when changes are, especially now when it's something that's happening so much and so often. Next slide. So with a new Part D cap of $2,000, this is for 2025 for your prescriptions, Part D, would you expect this to be the most a myeloma patient would have to pay for outpatient treatment? Absolutely not. Please do not misunderstand this. Again, that is for your Part D prescriptions that are covered under formulary. You may have other treatments that may not be covered under formulary, other types of medications. And another thing people need to be aware of, where are you getting your treatment? Have hospitals changed? Have providers changed? Are they moving some, it's very common recently, in the last couple of years with Medicare Advantage plans, where some of the providers will no longer take some of those Medicare Advantage plans that they were taking before. You need to look at that so that you won't get stuck. So no, you can end up paying more than that $2,000 out of pocket. And in some cases, you may find that your premium for your Part D or your premium for your Advantage or Medigap plans have increased over the last year. This is another way for making up for that difference for that 2000 versus what you've been paying out of pocket before. So don't expect that that's going to be the only amount you're going to be paying for prescriptions. You need to look at your plan. Everybody need to look at their plan. The next slide. Do you have any recommendations for how to deal with outstanding medical debt from cancer care that's accrued over several years and has been handed over to debt collectors? This is a very, very big question. Now, you know, a couple years ago, there were some legislative changes that said that medical debt under $500 does not report to credit. And if you have any on there that you've paid off, you need to go and talk to them and have those that take it off of your credit report. Anything over $500, you need to look at your state laws, statute of limitations regarding debt. What type of debt, how much the debt is, where it came from, where it originated, what the contract was. And this is not just medical debt. If you pay through credit card, then you might need to find out where that credit card was established, even though you might be in the state of Kentucky or like such as myself, but that credit card is out of, I don't know, Baltimore or California, then you have different state laws you need to look at, because after a certain period of time, the statute of limitations may run out. And that means it is called time barred. After that period of time, if you have not contacted them, if you have not agreed to anything over the phone, if you have not signed anything or sent in a payment, then over a period of time, that debt is called time barred, where creditors cannot reach out to you. Again, it's depending on the state. You need to find out what the state statute of limitations are in your state, as well as the type of debt you have. Now, you may have options to call and talk to those collectors about setting up payment plans that can be extended over a period of time. You don't want to be in a situation where you're not paying debt on a treatment facility that you've been going to that's taking care of your treatment, and all of a sudden they're not going to accept you to continue to have your treatment there. You want to stay in as good graces as possible. Still, again, reach out to that treatment center where you incurred that debt originally and find out what you can do. See if they have, especially if you have ongoing debt that may be accumulating, you might find out that they have charity programs at the hospital. They may be able to reduce the amount, or you may have payment plans set up for you there. The last thing you need to do is to not open up that piece of paper and not address this debt in some way. Next slide. Does Medicare cover or contribute to MGUS identified conditions as treated by Prevagen IVG infusions monthly? They claim that's not a covered condition. Now, I don't know what kind of medication or Medicare plan or Medicaid you may be on. Generally, and I'll say this from some experience with my husband having started with MGUS, a lot of patients are not treated when they get MGUS because it's not turned into the actual disease, multiple myeloma. Now, everybody's different. Evidently, you have conditions that Prevagen is paying for. Now, it depends on how your provider is coding this. You might want to ask them how it can be coded. Can it be coded differently? How they will address that with the insurance company so that it could be taken care of. Again, just because it says on the plan that it may not be covered, you have the option to ask for an exception. If the doctor finds this is medically necessary to offset disease in the future, or to mitigate physical problems in the future, then you have a possible appeal or an exception that can be done. Now, that would be through your doctor's office reaching out to the insurance company and saying this is medically necessary for your treatment. This will, I think a lot of people stop at that first no. They'll read or stop at that first no, but you have options. Even though you got a no, you may have several options even after first or second no to get things approved. So start ahead of time, ask for the prior authorization, ask for that exception through your insurance company to see if those things can be treated. Again, I don't know what kind of medical plan you have, but everyone has options for appealing. If you ever got a EOB, or evidence of benefits, they will have on there how you can actually start appealing a claim or you can call the doctor and call the insurance company and ask what options they have available to you and how your doctor can get in touch with them. That's the best thing to do. And don't necessarily do it on your own. Your doctor needs to be involved in this. Next slide. What types of treatment and care costs are typically not covered in a Medicare Advantage plan for smoldering myeloma or for multiple myeloma? This is a wide open question. Sometimes stem cell treatments are not covered depending on what the person's age is, depending on what, there's so much involved if they have had a stem cell treatment or if they have not had a stem cell treatment. And every Medicare Advantage plan can be different. You have Humana, Aetna, Anthem, United Healthcare, all these different plans. And even among like the Anthem may have 4 or 5 different Medicare Advantage or 10, 20 Medicare Advantage plans, and they vary from city to city, state to state, what they will cover. So typically, I don't know what typical is when it comes to thousands and thousands of plans across our country. You need to, again, find out what options you have available. You can get free help through SHIP, your state health insurance program. And there are people there that can walk through every single medication you have, all the treatment you have, look at your where you're getting your treatment from, the facilities, and find out what is and what isn't covered so that you can do some really good comparisons. And they are not limited on a few Advantage plans. They will look at everything so that you have the best information so you can make the best decision based on your needs in your zip code, in your city, in your state. So they will help you, and there's no cost for them to do that. Generally, I was on it trying to get for an example, I was on it a week and a half ago because my son is disabled and trying to get him Medicare. We decided between Medicare. They can also help with Medicare Advantage or tell you where to go to get Medicare Supplement or Medigap plan. And we opted for a Medigap plan. I will tell you this, between a Medicare Advantage and a Medigap plan, Medicare Advantage plans have limited networks, HMO, PPO, whatever. You have limited networks. You have to go in that area. Under original Medicare, Part A and Part B, doctor hospitalization medications, and your plan Part D, if you have a Medigap plan, you can take that anywhere that you go for a Medicare Advantage. So you're not stuck in a limited area or scope for getting care. So if you have the ability, and doctors are actually saying you get better coverage under Medigap. A lot of doctors are saying that, especially specialists with or treating high cost care such as cancer, treat illnesses such as cancer. You might want to look at, if you still have the advantage, opportunity to look at a Medigap plan in addition to Medicare Advantage, so you can get a really good comparison based on what your needs are. So I can't tell you what's typically not covered because they're all different based on what each individual plan is going to cover. Next slide. Will this disease bankrupt my savings account? I have Medicare A and B, Medigap Plan G, which is one of the best ones out there. If you're in, very few people could still get in Medigap Plan F, and still deciding which Part D plan to purchase. None of the insurers covers Revlimid for 2025. Again, I don't know what your savings account has. Very few people have a lot of money just sitting in savings that's going to pay $270,000 a year for Revlimid, and that may not be the only drug. Again, look at generics, see if they are covered. Look at getting an exception. If you're having a hard time getting a generic or it's not available, get an exception. And doctors are asking people to do that. Do it now before it's too late. That is one of the best options you have. Ask for an exception to see if you can get that Revlimid medically necessary covered. Next slide. Could my coachee be eligible to access additional resources for infusion copays, medication, etc.? Now, I think this question was a little bit more broad, and because some of the questions are broad, I'm not a clinician. I will not answer any clinician. I can refer you over to maybe our navigators that are here that can help answer some of those questions. When you have infusion copays, medications, and you maybe have limited resources or your insurance, you're underinsured, You might want to talk to, if you have Medicaid, they have extra help for Medicaid where some copays and things can be taken care of. I would start with my oncology nurse navigator. I would talk to somebody in the billing department. I would talk to the social worker wherever you get these treatments and see what resources they have available. They should know the answer to all of these based on what your insurance plan has and what is available to you in that state. So if you'd like to have that coachee reach out to one of the financial advisors and we can get more specific into this situation, we would be glad to help. She just needs to go in and ask for a coach, a financial coach. The next slide. My wife has reached a point of having difficulty walking. I am looking for assistance in purchasing a riding scooter. I totally understand this situation. If you're taking medications that causes neuropathy, even though you may not have muscle problems, you may have nerve problems, and you don't feel the bottom of your feet. This can become a very hazardous problem. So there are, and you're the first person who asked me this question about a riding scooter, in addition to other mobility aids. Medicaid can help you pay for a riding scooter, or you can rent one if you can't afford one outright. You can find a used one. Medicare will also help you with assistance. They will not pay for all of it, but they have assistance that can help you pay for a scooter or rent a scooter. And there are other organizations as well. Some of those organizations include American Outreach Foundation, Friends of Disabled Adults and Children, the Tyler Shrink SCHRENK Foundation, Hope Haven, United Way, New Motion Foundation, and Triumph Foundation. Now, the answers or the questions with the answers will be available to anyone who needs to reference them. So those links or those foundations will be accessible to those people. I'm also going to add this to our financial resource link because more and more people are talking about neuropathy and difficult getting around. It doesn't just refer to riding scooters. It's anything to help with your mobility, whether you need van assistance or modifications to a vehicle, if you need ramps, anything for mobility, there's some assistance you can get from somewhere. And I will have these put on our financial resource page. Next slide. Is it too early at this stage of multiple myeloma to be looking for an MM specialist? Now, if you're MGUS or smoldering, I would say it's never too early because at some point they're going to start staging or they're going to start looking at your genetics, right? To determine what type of myeloma, if you're smoldering or if you're MGUS, what it may turn into or is turning into. You want to always keep a good idea of where you are in your treatment and what options to be available. I would say as early as you can, speak to a specialist about what you know about your disease, the better off you're going to be. That gives you a foundation to work on. The best treatment, the best ongoing or long-term treatment is the best treatment you get initially. So I would say look to an MM specialist. There's never too early if you have MGUS or smoldering to talk to an MM specialist so you could better understand the disease and what it may or may not turn into. The next slide. Does HealthTree keep a list of financial resources available for multiple myeloma patients with information about how to access them? For example, I got a grant from HealthWell Foundation to cover my Revlimid costs. Now, HealthWell Foundation, LLS.org, copays, cancer care, there's several nonprofits that'll help with the cost of Revlimid. A lot of them have reduced their grants. They've been cut in half, like LLS, and I think HealthWell is going to be cutting theirs. So we do have a list of financial resources. Again, you go through our HealthTree coach apps, financial resources, you'll be able to see the list of those on there as well as in a link, and it'll tell you how you can apply for those. They can be done over the phone, you can do an application, but keep in mind, they will have to send out verification of treatment to your doctor. And sometimes that's where the time takes a lot of time, is when your doctor gets it to fill that out and return it to them. If they may require you to do income verification, sometimes they can do that really easily without having to go through you sending in tax documents. But each foundation, if you get onto their initial page, their about us and what we do, they will tell you how to fill out these applications. It used to be that you can have put on a waiting list, because it's become so popular and a lot of people have used or using their grants, that sometimes there is not a waiting list. You have to keep checking back to find out if the grants have been opened up where there's funds available. So yes, we do have it on our HealthTree coach website for resources. The next slide. I know that the $2,000 max out-of-pocket cap is only for covered drugs. Would you expect the outpatient drugs to be covered for myeloma treatment? Would you expect the outpatient drugs to be covered for myeloma treatment? I'm going to jump off as if I'm understanding this question. Outpatient drugs, meaning, I'm not sure what you mean by outpatient drugs to be covered for myeloma treatment. So if it's drugs that are covered under your plan, your Part D plan, or your Medicare Advantage Part C, then it would be covered, and that amount will be going towards your $2,000 cap, you're out of pocket. If it is not covered under your plan, then you may have to, under your plan, there are drugs that, your outpatient drugs, I'm assuming that's if you went to a different place, may be covered. You got to make sure that everything is based on what is in your plan, formulary or non-formulary. And non-formulary, which means it's not going to be covered. You'll be responsible for that full cost, and it does not go towards your deductible. So I'm hoping I'm answering what you're expecting, that question is. If that's not the answer, please sign up and ask for a financial coach. You can specify me, and we can get to that into more depth if I did not answer the question you were asking of me. Next slide. What resources are out there for copay assistance on CLL? Many of the programs where myeloma patients get assistance, they're usually through blood cancer organizations, or cancer organizations. HealthWell, LLS.org, LLS, copays.org, Cancer Cares, they all have, almost all of them, I would say probably all of them, have copay assistance for CLL. I would also check with your pharmaceutical company that manufactures your prescription to see what kind of copay assistance they have for your medications. All you have to do is ask, and your oncology patient navigator or the social worker where you're getting your treatment should be able to get you started on that. You can also reach out to financial coaches here at HealthTree or some of the patient navigators. They may be able to assist you as well. But there are copay assistance programs for people with CLL and other blood cancers as well. Next slide. What resources are out there for travel assistance for treatment, and what are the dates to apply? There aren't any specific dates, except you want to apply for these before the day you need the actual assistance, because it may take a while for the applications to go through. LLS has travel, but last I looked at that last week, it was not open. Now we're going to be going into a new year, and those programs may open up for with more funding. I have on the website, the financial website, additional programs that offer travel assistance. And again, I always encourage people, because we said, and I have a tendency to forget, you can dial 211 in your area, and 211 can tell you what kind of financial resources are available to you in your area, whether that's travel assistance or help for Uber, or help for what is the other travel pickups. There's other organizations that can help you with travel, whether you need to go from one city to the other, one state to the other for treatment. There may be assistance for bus, for car rides, for airplane rides, for all of those things. I have them listed on our financial website where you can find all the other treatment or nonprofits as well. Next slide. What are the range, average, and median yearly and cumulative cost of non-covered care and treatment of smoldering myeloma with an Advantage Medicare plan for multiple myeloma? Now, this is a loaded question. I could not find this information because there are so many Medicare plans, and there's different types of treatment or coverage for smoldering myeloma, and how your doctor is going to have that coded. What other things are specific to your health? So I could not answer that question. I'm sorry. That's a loaded one. Next slide. How can MGUS be treatment coded differently so payment does not become the patient's sole responsibility? This is huge. Now, when it comes to coding, that is such a convoluted, nebulous thing that happens in doctors' offices and clinic and facilities based on the treatment and other issues regarding that particular treatment. Is it regarding MGUS, or is it related to another type of illness you may have? So that is not something that I don't think anyone can answer. And I don't even know how a doctor can answer that, because there's so many laws and regulations, because how things could be coded based on Medicare, based on Medigap, based on private care insurance, and again, based on your illness, your situation. So that is one that I can't answer. I'm sorry. Next slide. Boy, did we get through those already?
I know, I was just going to say the same thing. I'm glad we were able to open it up for questions. We weren't sure if we would get to this point. So thank you, Diana, as always, for all of the great information. We do have a few minutes, so if people want to ask some additional questions, we're going to open it up. You can type those questions in the Q&A, and we'll try to get to as many of these as possible. So we did get a few so far. The first says, which Medicare Part D drug plan and Medicare supplement plan, Medigap, are best for a myeloma patient? I'm transitioning to Medicare in April.
Okay, I would say that if you have a high cost disease and you may be seeing multiple specialists, and you're already considering Medigap, you've already done the comparison between Medigap and a Medicare Advantage plan. The one that's going to give you the best coverage is your G plan. So if you're not available, you're not eligible until April, you cannot do an F plan, but you can do a G plan. But then look and see if you can get, I don't know what your income is, you might be able to get a Medicare savings plan that might be able to help you with some of the additional costs, like your Part B premiums, because you have to have Part A and Part B in order to sign up for a Medigap or a Medicare Advantage plan. Now, when it comes to your drug plans, your Plan D, that is where you need to call SHIP, SHIP, in your state, or call a broker or someone in your area that can do those comparisons for the Plan Ds, because they vary greatly. And you want to make sure that you are going to be getting the best plan that's going to give you the best coverage based on the medications you're taking and maybe taking in the near future.
Perfect. Thank you so much. We have another one that says, I just received a bill a few days ago for a blood test done in February of this year. Medicare denied the claim, saying that the test was not medically necessary. I was told it was too late to file an appeal. What should I do? And why would it take 9 months to get the bill?
That's interesting. You can ask a doctor to send you proof that they did not send the bill until now. A lot of insurance companies will say that they didn't bill in time, and that is not your responsibility, because if they did not bill that to you, then how would you know what the bill is from your treatment facility? I would ask them, I would call your insurance company and find out when they received that bill. And that is going to be part of your appeal process. Just because you got knocked down once, that not mean that may be an internal appeal. You might ask for an external appeal and talk to the state. There are at least 3 or 4 different pass-bys or different options you have, levels to take appeal to the next process level. The first thing, because it's been since February, the insurance company say we didn't get the bill until this period of time, so you are not legally responsible for it because that is the provider's responsibility to get the bill in a good period of time.
Perfect. Thank you so much. We've got a comment that says, for Medicare people in 2025, please remind people that HealthWell changed covered costs to only paying for the Medicare Part B premium if you're using them to pay premiums. Before 2025, they would cover the cost of Medicare supplement and also Part D for drugs in addition to Part B. This changes in 2025. It sounds like there's a lot of changes, not only to Medicare, but also these places that help with those costs as well.
Right. And if you were at HealthWell and you wanted it for premiums, and then somewhere down the road you realized that you were going to need that money for some other thing, you had to make a decision and you couldn't change it. And you were stuck on that. And so because there are other places like LLS that will help reimburse for the cost of premiums through their grant program, and because grant programs have, a lot of them have reduced what they're doing in grants to cover more people. And because they're looking at that $2,000 max out of pocket, they don't think the need, I don't know, the term is probably as great, especially since you have Revlimid dropping off of Part D, and the need may be greater for some people. That's what they're doing. And so, yeah, be careful when it is possible to get more than one nonprofit grant. You can have one through LLS or HealthWell or copays, but you got to let them know. Sometimes they'll ask, sometimes they don't, depending on who you're talking to on the phone at the time. Ask what you're going to use the grant for. And if you say copays, and then with HealthWell, it's going to be for copay or copays, not travel or I mean, not premiums, then use the other one for the other need and stick with that. Make sure you do your calculations to find out what you expect your out-of-pocket costs to be and what your medicines are going to be, so you can understand what your copay costs are going to be, co-insurance and all those things as well.
Perfect. Thank you. I have a next one that says, if I have AARP United Healthcare Medigap Plan G, does my Plan D have to also be AARP?
No, it does not. You don't have to get the same plan that you have with your insurance. No, you don't. You can get a completely different plan. Just make sure that it's going to cover the medications you need to have covered.
Perfect. The great question. I think if I was in the same boat, I'd have that same question. So thank you. If my specialty pharmacy does not have enough of generic lenalidomide to fill my prescription, does the insurance company have to cover the Revlimid brand version in order to fill my prescription? Of course,
They
we've got
don't.
this question.
I'm sorry.
Go ahead. Oh no, sorry. Just reiterating that Revlimid is dropping off the formulary. So
Yeah, they don't. But again, this is one of those things where the doctor may say it's medically necessary. You cannot get the lenalidomide. You may not be able to get an additional option for that Revlimid. Then if it's medically necessary, then again, there is that prior authorization. There is that appeal for an exception for your insurance company. When the and that's going to, they may have to do a peer-to-peer review, something. There's going to be a process. So start on that as soon as possible.
perfect. So we've got a question about immunizations. We've got a patient that had to have a third pneumonia Prevnar 20 shot that they had to pay for out of pocket. And the CLL specialist wanted them to get an RSV vaccine yearly. WellCare did cover it for my second shot this time. But just wondering how you go about immunization specifically. Is there any way to hopefully get those covered?
Well, if it's being required from your doctor, because of your illness, you might say this is medically necessary based on the doctor. And you can go, and there's different clinics there are some clinics that were giving RSV shots for free. Get online and check your CVS, Walgreens, and see if you can get that RSV shot for free. If it's already been done, you've already gotten the shot and it was medically necessary, you can still put in an appeal for that bill. And the doctor with a note saying this was medically necessary because this person has this and immunosuppressed, they need to have it. It's not like me, I don't have some of the illness you have, and I'll go in and just say, I want to make sure I get covered again. That's different. But if the doctor finds it's medically necessary to offset illness or disease in the future, especially winter coming on, then you should be able to do an appeal through that.
Perfect. I've got a question from the same person just asking about, says our CLL specialist wanted the fax number of Medicare. Is this possible? Is there a direct number that you know of?
For CLL?
Yeah, it says for
No,
Medicare.
no.
Okay. Okay. I am a multiple myeloma patient retiring at 70 in 6 months and currently have wonderful health care. Do I need to do anything now to prepare to move forward with insurance now, or am I okay to wait until I retire?
When you retire, you have 30 days from time you retire to get that done. I would suggest, because you still may have the option, to get a Medigap plan if you wanted to go that route versus a Medicare Advantage plan, because you had creditable coverage through your employer. Now, with your Part B, I don't know what your income is, or your Part D, depending on when you sign up, then there may be additional costs associated with it. I would suggest you talk to Medicare as soon as possible before you leave work, because you don't want to have a gap in coverage. Go in and sign up for it now, and you can say, I want to start on whatever date, the day you leave work, for the first of the following month. So you can make sure you're not going to have a gap in coverage, because you will have fees and things associated at that point.
Absolutely. I think that's great advice. Thank you. Our next question says, does Medigap coverage vary per insurance company? I understand Part D coverage varies, not sure about Medigap.
Okay, Medigap has different plans, and different plans give different levels of coverage. The highest level of coverage that a person can sign up for now is Medicare Part G. So it provides a lot more coverage, broad coverage, than some of your other plans. The costs are different. All the plans have to offer very similar coverage levels. Every plan in the G, every plan, whether that be United, Aetna, in the G plans, everything under the A or B plans have to have their own specific things. But among the actual levels, or like A, B, C, D, G, F, whatever they are, they differ in price. They can differ in coverage levels as well. If you go into Medicare.gov, they will have what each plan should cover, the different levels of like a G plan or A plan or a B plan. And it'll tell you what they will cover, those basics, the big things that have to be covered under each plan. But within those plans, you need to look at that within those specific plans, what its coverage is going to be.
Okay, thank you. Got a question about if these questions and answers will be posted online after this call. Of course, we will send those out and the recording will be available. We'll make sure you get a copy of that as well. So thank you for that question. Next one is, how do I decide between a Medigap G plan and a high deductible plan G?
Interesting. You got to look at everything that's going to cover, and look at what your max out-of-pocket cost you expect your max out-of-pocket cost can be. What I would say for a high deductible plan, because you have this health savings account that you can establish, that money does not go away. It helps to offset future cost. Though that money can be invested, so it can grow. And you can use that, especially if you have time, if you're not close to retirement or you're not retired, to start setting aside money for future costs, such as deductibles or co-pays or any out-of-pocket cost. And it depends on what you expect, how often you're going to be going to the doctor, how much your premium is going to be. I'll tell you that money never goes away. It rolls over and it stays in your plan every year. And so it's a great way to pay for something in the future, for future costs. We know our cost of our healthcare is not going to go down. We know that we are probably at our healthiest right now today than we'll ever be. Well, it depends on how old you are. Me, I wonder about that on any given day. But you got to assume that somewhere in the future we aren't going to be as healthy as we are now. And so a good idea is if you can afford a high deductible plan, you don't go to your doctor very often. You start setting aside money so that when the time comes for you have to pay for copays, deductibles, higher costs out of pockets for care, that you'll have that money there and it could be growing in an account. Like I said, it could be invested. And so it could be growing and it comes out tax-free to you to pay for your medical care. So there's a lot of options that are available under high deductible that you wouldn't find on a regular plan. But if you don't have the money for a high deductible plan, let's say you have a high deductible plan that's going to be, let's say, $15,000 for your deductible. And you know you don't have all that money set aside in that healthcare, you can't afford to put in that healthcare savings plan right now. It's not going to do any good for you because it's not working. You're spending that money as soon as you get it out of pocket. So it might not be a good idea to do a high deductible plan now, maybe somewhere down the future. In the future, you might want to look at a regular Medigap plan that gives you really good coverage as well.
Perfect. We've got a comment. I'm going to kind of turn it into a question about if you move and your Part D coverage is discontinued, um, what is the next step? So it sounds like maybe if you're moving between states, is that something that happens often, Diana, that your Part D coverage may be discontinued?
It can be discontinued. And if your plan, whether you have a Medicare Advantage plan or a Part D, you get special enrollment if you move or they drop that plan completely, where you can go in there and pick up another plan. That does happen when people move out of network. Yes.
Okay, that makes sense. We've got one other statement real quick that we'll try and work into a question as well to give us a little bit more information. It says, I heard if you take a Medicare Advantage plan, the supplemental insurance company can deny you later. Does that sound like something you can speak to there?
Timing is timing is huge on this. If you have a Medicare Advantage plan and you've had it for more than a year, 6 months to a year, then you can go back to original Medicare and possibly try to get Medigap. The insurance companies, if you're past that guarantee issue period, when you were first eligible to sign up for a Medigap plan, the insurance company can deny you based on your illness, may not cover you for that illness, may cover you for something else, or they may deny you completely. So the best time to get a Medigap plan is when you're first eligible to get one. That way you have guarantee issue, doesn't matter what your physical health conditions may be. And it's guaranteed to give it to you no matter what. If you wait, then yes, they have the right to deny you. And the cost could be very high.
Perfect. Thank you. I hope we answered all the questions sufficiently. I know there were a lot that came in, like you said, that, well, a few that were more medically based. So we'll try and get those off to the appropriate education manager. So hopefully we can get some information to you there. Um, that's all the questions we had in the Q&A. I'll give it just a few minutes. I had a question that came up as we were talking about what types of treatments and care costs are typically covered for smoldering myeloma and multiple myeloma. I'm wondering, as standards of care change, how quickly does Medicare begin covering those new standards of care? Does it just depend on which plan you have, or how does that work?
Well, generally, when they start looking at different standards of care, of course, you can always look for an exception if that's something the doctor finds medically necessary. But generally, they've already had those things set, and they start looking at those throughout the year for next year, because a lot of times it goes through. Um, there's so many things in the background that's causing those changes to happen. Not only with insurance plans, but how many people are being treated for that disease, what other scenarios there are with the disease. I mean, what new treatments are out there. So they can change, but generally once that is done for the year, that is what it's going to cover, unless you get an exception through your doctor or your insurance company.
Perfect. Thank you. Got one more that says, aren't there a few states that you can switch to a Medigap and cannot be denied for a pre-existing condition?
There may be, but I will tell you this: with all these things changing in the arena, you may have a hard time. They can offer you the insurance. They can offer to. They say, yes, we're going to cover you, but it's the cost going to be prohibitive because you may have an existing condition. They may make that cost prohibitive, or they may not even cover that particular illness that you really need the insurance for.
Okay. Got a few more that rolled in, so we'll truck for just a little bit
Okay.
longer. We've got one that says with Medicare Supplemental Plan G, if you change who you get your plan from, can they also deny coverage?
Can you read that again?
Yes, absolutely. Sorry about that. I was a little clunky with it. So with the Medicare Supplement Plan G, if you change who you get your plan from, can they also deny your coverage, etc.? Also deny coverage.
It's, it's kind of confusing because if you got a Part G, you can change your Part G plan anytime during your Part G plan anytime during the year. Um, I don't see how they can deny you coverage under Part G plan.
Got a follow up that says
Only if, I mean, you
providers.
can switch, you can switch plans, but if you drop off of it and then try to get back on it, they may deny you at that point.
Perfect. The next one is just asking if you've heard anything about telehealth in 2025 with Medicare. Have you heard anything about them not covering telehealth visits?
That's another one that's there's a lot of fight and bickering going on about the telehealth. They realize how important it was during the COVID, and especially when a lot of hospitals still have they still don't have a lot of coverage. That they maybe have shortages of nurses and everything. There are some companies that are saying they're going to continue to do the telehealth, they're going to continue to cover it, and others are, we don't know what we're going to do. I would ask that you reach out to your provider and ask if they're going to continue to provide the same amount of coverage, or continue to provide coverage for it at all. And that is a per plan option.
Perfect.
A lot of the
Um,
doctors also saying they want to keep the telehealth. It keeps people out of the office, and with RSV and everything going around now, they just prefer to be able to do those things um, via telehealth if possible.
Absolutely. I know it's been a great advantage to all of us. So I hope that's something that will be covered. I have one that says I have a drug savings card, which ends up being a $10 copay that is good when covered under private insurance, but I cannot use it when I go to Medicare. You know why there's that restriction?
I do not, because I know it may depend on what kind of prescription card you have. They are not insurance cards. There are several, and you can have more than one. There's Needy Meds, there's I can't think of, there's so many of them. You might want to check with your pharmacy, call your pharmacy and ask them because they will know. Ask them what prescription cards do they take when you're on Medicare. And they'll tell you the ones they found has been most beneficial that is accepted with Medicare.
Okay, perfect. Got last one I think we'll call for the day. We've got a few more that came in, but want to be respectful of everyone's time. With those additional questions, of course, make sure you sign up for the next time we do our Q&A. And I'll jot these down as well and see if we've got some resources to send out. But we're circling back to the Medicare Supplement Plan G. If you change who you get your plan from, meaning um, Humana or Blue Cross Blue Shield, can they also deny your coverage? So does that make a little bit more sense if
It
they go
does. If you're
between?
still in
Okay,
Plan G and let's say you have Humana and you want to go from Humana to Aetna, and then you want to go back to Humana, can they deny coverage? I am not sure about that. If you're going in the same plan year, possibly. If you're doing it a different plan year, probably not. I'm not sure, but I can find out about that.
okay, perfect. Thank you so much. Again, thank you guys all for coming and joining us today and for the wonderful questions. I know I've learned a lot, and as always, thank you, Diana, for being so prepared and being so knowledgeable. All of this is so tricky to navigate, and I know with the added pressures that come from a lead cancer diagnosis, it's hard to get to the bottom of these answers. We really appreciate you.
You're welcome.
Thank you. All right, we'll go ahead and wrap up for today. I just want to take a moment to share something really exciting with all of you. One of the most powerful things about our community is how we come together to make real change happen. Right now, we have an incredible opportunity to advance blood cancer research. We're working to power 100 research projects that will change lives. If you feel called to participate, you can contribute in two meaningful ways. First, by sharing your medical journey by joining HealthTree Cure Hub's registry, because your experience matters and can help researchers understand patterns they may not see otherwise. And second, if you're able, through a donation and sharing this fundraiser with your family and friends. All donations will go directly to research. In our follow-up email, you'll receive the links to join HealthTree Cure Hub and to donate. Thank you all for being an integral part of our community. It's our goal to make meaningful change in your lives through this initiative. As you leave the session today, again, we would appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience. And so just take a moment if you're able to fill those out. I know it helps guide me in making the decisions on new webinars we want together. So thank you if you have that time to fill that out. I really appreciate it. Here are just a few of our upcoming events. Tomorrow, Wednesday, December 4th at 1 p.m., our DLBCL community will be learning about bispecific antibodies with Dr. Lorenzo Falchi. On Thursday, December 5th at 1 p.m. Eastern, we'll have another opportunity to learn about HealthTree Regional Care Team and how you can get involved. This one is for the Northeast, Southeast, and Midwest regions specifically. We're excited to get these care teams up and running and to provide another way to connect as a community and drive us closer to a cure for all blood cancers. So take a moment to sign up for that if you're able. On Wednesday, December 11th at 5 p.m. Eastern, we'll have the special treat to hear from our founder, Jenny Alstrom, and many of the others here at HealthTree who will highlight how HealthTree is investing in cures. We have many more virtual and in-person events in the works that will be announced shortly. The link to sign up for these and any other events will be available through the email that we show in the event completion. We also have the link there at the bottom as well. Before we go, I wanted to highlight the Track My Disease feature in HealthTree Cure Hub. Once you've connected your medical records, the Track My Disease feature provides you with the ability to gain one-of-a-kind access to your health information encompassing lab results, genetic profiles, and treatment histories, offering you invaluable insights into your own medical journey. On the screen, I have the link to sign up for HealthTree Cure Hub, along with the email address of our amazing patient navigators who are available to help you create an account and connect your records. We'll also include this information about how to enroll in HealthTree Cure Hub in our follow-up email, so keep an eye out for that. I'd like again to thank our sponsors, Pfizer, Regeneron, Johnson & Johnson, GSK, Karyopharm, Bristol Myers Squibb, AbbVie, Sanofi, Adaptive, and Genentech. And finally, I just want to say thank you again for helping us build strong blood cancer communities. I've added my email address to this slide, so please don't hesitate to reach out if you have any questions. If you want, I can also forward that to our other educators as well. I appreciate you all and hope you have a great rest of your day, and also hope to see you at another webinar soon.